everyone, welcome to the third video. My name is Nicole Yaron, and before we continue, let me just take this time to congratulate you. You are 2 videos down, 1 more to go. Alright, so what you've done so far is you've gone over STDs, you know what they are, the risks involved, you know how to prevent them, you even know how to put on a condom correctly. So, you are doing a lot better than a lot of your peers right now. But today we're going to take a little bit of a different turn. We're going to be talking about the 5 most common myths surrounding STDs. Alright, ready? Myth number 1. Only trashy people get STDs. This is very much not true. STDs do not discriminate. So you can get an STD if you've had sex once, twice, multiple times, or even if you've just had any sort of sexual contact at all. Alright, myth number 2. If your partner has an STD, you'll see it. Fact of the matter is, oftentimes there's no sign that a person has an STD. I know that you have been scared in a lot of your health classes with pictures of lesions and genital warts and a lot of pus, but frankly, if you suspect that you have an STD or your partner has an STD, the only way to really find out is if you go get blood work and get diagnosed by your doctor. Most of the time, those images that you've seen are not going to be occurring very often or with most STDs in general. Sometimes there's absolutely no symptoms at all until it's progressed very far. So, myth number 3. You can avoid STDs by having oral or anal sex. I know this myth is propagated a lot by people who really just want to have a sexual experience and be able to say, I'm not really having sex, it's fine, it's safe. It's not. So where there is sex, that can be oral, anal, vaginal, or any type of combination where there is sexual fluids being exchanged, there can be STDs. So the bacteria, the viruses, the parasites that cause STDs, what they do is they are transferred from person to person via bodily fluids. If the transfer is occurring, then the infection is occurring. All right, now we're going on to myth number 4. Once you've had an STD, there's no chance of getting it again. STDs are not like the chicken pox. You can get them over and over and over again. So generally speaking, there are chronic STDs, there are acute STDs. So your chronic STDs, your herpes, HIV, what happens is you are going to be going through treatment probably for the rest of your life, depending on the severity. So herpes tends to pop up in flares. HIV tends to get a little bit more complicated. So you can go on various treatment regimes, and it is going to cause health issues down the line that you do need to be aware of, and you do need to keep on top of and communicate with your doctor. More acute STDs, chlamydia, gonorrhea, things like that, they're pretty much going to be, you go to the doctor, you get some medication, you get treatment, it's going to clear up. You're going to be fine, so long as you don't let it progress too far, which is why you really do need to keep up with your doctor and communicate just in case you suspect an STD has infected you. Alright. Doesn't mean that once you have gotten and cleared up those diseases, that they can't come back. They're like the common cold. You come in contact, they're going to come back and bite you in the ass again. Alright. Myth number 5. Just because you've gotten checked and you are STD-free doesn't mean your partner doesn't need to get checked as well. So your partner is not you. Just because you are STD-free does not mean that they are STD-free. If they come up to you and they're like, hey, I think I might be infected or something's wrong, get them checked. They need to communicate with their doctor. And if you think, hey, well, if they think something's up, maybe I should get checked again, because you don't know what's happened in the meantime. So keep that communication open. Your partner might have it and not even know it, and they might have passed it on to you. So you really do just need to be able to keep up with those prevention methods and keep up that communication. All right, before we go on, we're just going to do a quick recap of our 5 myths. So, myth 1. Fact of the matter, STDs do not discriminate. They will infect anybody at any time, no matter how much sex you have had. Myth number 2, and the fact is, often no sign that a person has an STD. So, just because you've been frightened with pictures of all the different symptoms doesn't mean that they're going to be occurring. Myth number 3, the fact is, where there is sex, there are STDs. They travel in the sexual bodily fluids, and if you've come in contact with them, you can get infected. Myth number 4, fact of the matter is, you can get STDs more than once. They are not the chicken pox. They can come back over and over again, and you really do need to stay on top of the prevention methods in order to stay safe. And finally, for myth number 5, the fact of the matter is, your partner could have an STD and not even know it. All right? Excellent job. You are now aware of the top 5 myths surrounding STDs and the fact behind them. What I'm going to do now is I'm going to pass you over to Humberto, and he's just going to do a quick little recap just so that we can make sure that everything we have told you over the last 3 videos is now completely stuck into your brains. So Humberto is going to go talk to you about STDs and just do a quick little summary on them. All right? Thank you. Humberto, take it away. Bye.
By any sexual contact, vaginal, anal, oral, even not what you quote unquote think is sex. Just skin to skin contact can transmit some of the different types of STDs, such as herpes and HPV. And it can happen to you. As mentioned prior, of the 20 million infections each year in the US, half of them happen in young adults, anywhere from 15 to 24 years of age. And of all the infections that are listed under sexually transmitted diseases or STDs, a good chunk of them are happening in young adults. HPV, half of them are in young people. Chlamydia, trick, you name it. Pretty much, it's something that you have to take into consideration. And why is it that young people are more likely to get STDs? Well, first, young women's bodies, they're biologically more likely to get STDs. Young people often don't get tested. So if you're not tested and you don't know you have one of these diseases, you're more likely to transmit it to somebody else. Also, getting tested is sometimes seen as a problem, as a hurdle, whether it's because you're not covered through insurance, or you don't have a car, you don't have money to get to where you need to go to get tested, or you may not even know. Another factor that can increase the likelihood of getting a STD is having more partners. So I'm going to recap the next couple of slides, some of the STDs we spoke about. Remember that chlamydia and gonorrhea often go together as far as the types of symptoms that a person can get and the kind of complications that you can get. So first, you could present with no symptoms. And depending if you're a man or a woman, a lot of times you're not even expecting to get symptoms. So if you don't feel like you have anything, you're not going to get tested. Wrong. If you do have symptoms, what often you'll see is some discharge, maybe not usually different color, but could be painful, just could be off. And that could be the clue. And if you don't get tested and you don't get treated, the dangers are having kids in the future, or fertility problems, usually because of an infection that happens in your pelvic area to your reproductive organs. You could get pain or swelling and infection of your testicles, or other sites that become exposed, such as your rectum, or throat infection. All right. So specifically, chlamydia is the most commonly reported STD in the US, and most of the reports are in young people, people 25 years old or younger. It's usually spread in the typical ways you would engage with sex, and just pulling out is not an option. You can still get chlamydia even if the male does not come. Just like chlamydia, I had mentioned before, chlamydia can make it hard for a woman to get pregnant in the future, causing difficulty getting pregnant or complications of pregnancy. And this one, unlike gonorrhea, you often won't even have symptoms. So you're more likely than not to get any symptoms. And if you do, it'll be some abnormal discharge. It's easy to test. You just need a urine sample. To treat, also very easy, just one pill of an antibiotic. However, the partner also needs to get tested, because if not, you'll just get it back from your partner. And if you're pregnant and you're not treated, you can pass it on to the baby. Gonorrhea, like chlamydia, spread in the same fashion. It can also is more likely to cause symptoms, with 3 out of 4 men having symptoms and half of the women. And it's usually painful urination for the men, maybe pain in their testes, and a discolored discharge. For women, just like chlamydia, it can make it hard for you to get pregnant. Maybe not to this effect, but burning nonetheless. And it's easy to treat. You need an injection or a shot on your arm and a pill. And unlike others, this bug is making it harder and harder for us to treat. And there's these strains called super gonorrhea that are showing up. So, the most interesting man in the world, if he ever gets gonorrhea, you know it's super. And winter is coming, so watch out. All right, herpes. Herpes, you can't just treat. It's a lifelong infection. You can get it in your mouth or in your genitals, different types. And either way, you can get those in either site. So remember, be careful. And you can get really, really sick by having this type of virus. These are some of the type of lesions you'll get. And it usually presents with these lesions, but you can still spread it without those lesions. And you treat it basically by either taking a treatment, a short course during the time that you get an outbreak, or by just taking a pill every day to prevent you from getting an outbreak at all, or making it less severe. Syphilis, again, coming in contact with the sore, but it could present in so many different ways. It could just present with rash. It could attack any of the organs, your heart, your brain, and in pregnancy, you could pass it on to the baby. So I'm going to show you some slides that should gross you out, but these are the reality if you get syphilis. These ulcers on your penis, in your tongue. You could get swollen lymph nodes. You'll get this rash on your palms, which is weird, not usually a place where you'll get these rashes. You'll get a rash all over your body, crusted look in the eyes. You'll get hair loss, brain is infected, etc. And it's very easy to treat. One shot, maybe 3 times in a span over 3 weeks if necessary, if you wait too long to get treated. HIV, 1 out of 5 new diagnoses are in young people between 13 and 24 years of age. A lot in our Black and Latino community, and male-to-male contact is the most common way that new infections are presenting. HPV can cause cervical cancer, can lead to warts, and is totally preventable if you get the vaccine. So how do I reduce my risk of getting STDs, you may be asking? Well, I'll let Kerry take over from here.
Thanks, Humberto. I hope you all remember the risk reduction strategies, but in case you forgot, here's a few reminders. For example, knowing how to properly put on a condom. If you didn't know how to do that, then you probably wouldn't have very good luck with not catching an STD or becoming or getting somebody pregnant. So it's important to know the basic information of how to do that and where you can get condoms, either at a local pharmacy or a doctor's office, or even their local resources, because a lot of the time people can complain that they can't afford them or whatever the case may be. So it's important that health centers and doctor's offices just have them available for people to take for free. So that is number 1 in risk reduction. So It is important to educate teens in school about potential risk if they fail to follow the simple steps to remain healthy and to avoid potential risks. So some of these steps can vary from seeing, a gynecologist for women annually, and talking to your doctor about a good method of birth control would be for your body, because there's all different types of birth control, varying from the pill or from the ring, or they have the things that you could put in your arm. So there's a lot of different options that you can discuss with your doctor. So that's really important in preventing pregnancy, unwanted pregnancies. So that is one way. Another risk reduction when talking about STDs would be the Gardasil shot, which is a series of 3 shots, and it helps prevent HPV and cervical cancer. So it's not 100%, like you're not immune to it, but it is a high chance that you won't get it if you do get the shot. So that is a huge risk reduction that you could take, that if you just talk to your pediatrician or main doctor, then you can get it from a young age. So the earlier the better. Also, if school, then it's just a good open communication where people can feel safe to talk about these things, because sometimes it can make people uncomfortable, or whatever the case may be. This is an open place in school where they go every day, where they know of each other and know the teachers and have relationships. So that's a good setting to introduce all this information to teenagers, when this could be an uncomfortable topic for some people. So I think that if that was incorporated into everyday class time, that students would really retain that information and benefit from it. So they could learn in these courses all the potential STDs that they could contract if they have unprotected sex and sleep with multiple partners. They could learn all about the potential symptoms to look out for if they feel like something's off, or they're going to make sure that you're safe and you're not passing these STDs along to other partners, because then they are also not having any symptoms, so then they don't know, and they could be potentially passing it along. So it just could become this whole cycle of never ending STD contraction. So it's important to get tested and to know your body and look out for potential symptoms. Luckily, some STDs are curable, but a lot of them are not. Some of them, like chlamydia and gonorrhea, are like all you need is like an antibiotic to get rid of it. So luckily those are the 2 most common. So there is a solution, but some of them, like the bigger STDs like syphilis and herpes, like that, is not curable. So like I said, it's really, really important to get tested and make sure that you're not passing these along to anybody else.
Thank you, Kerry. Thank you, Humberto. All right, guys, you have made it through all 3 videos. How does it feel? Very good, I'm sure. All right, so now that you know about STDs, prevention methods, the myths surrounding STDs, hopefully you're better informed and can make better decisions that will prevent you from getting infected and passing it on to others. All right? Thank you very much for sitting through all 3 videos with us, and I hope you have a lovely day. Bye-bye.